Hello again. In this video, we're going to talk about the different kinds of non-invasive ventilation you're likely to encounter in the PICU. First up, good old-fashioned nasal cannula. This device, as you probably know, delivers flow but no pressure. There are 3 different sizes, so they can be used for any age or size of patient. It's important to recognize that even if you set the FiO2 to 100%, patients are not actually breathing 100% oxygen, as they breathe in atmospheric air around the cannula and potentially through the mouth. We generally don't increase above around 4 liters per minute on a regular cannula, as other devices can deliver oxygen more effectively and comfortably. For patients who do require more than about that 4 liters of support, we generally switch to high flow. The device we use is Optiflow, but you may have kids transported from other institutions on Vapotherm, which is a similar system by a different company. Optiflow comes in different sizes for infants, kids, and adults, so we can find a cannula to fit all sizes of patients. At all of the different size points, the cannula has adhesive pads that hold it in place on the face, making it easier to keep in position than a standard cannula. In general, 2 liters per kilo is a good place to start for kids up to about 15 kilos. Compared to nasal cannula, high flow delivers a higher percentage of the set FiO2 because of both higher flow rates and larger prongs. It's also generally more comfortable as the air is humidified and the prongs deliver that air farther back into the nasal cavity. Although there's some thought that higher flow rates may be able to deliver some amount of positive pressure, high flow is not technically a pressure delivery system, and you should consider other options if you think your patient doesn't need the higher pressure. One option for delivering positive pressure to smaller patients is the RAM cannula. This specialized green nasal cannula is designed to fill around 80% of the nares, allowing it to create a closed system and deliver positive pressure. We recently acquired bigger sizes to allow us to use RAM in toddlers as well as infants. It can't really be used in bigger kids as the prongs won't occlude the nose and the system won't be able to create a seal to deliver that pressure. The delivery of CPAP depends on the child breathing only through the nose and keeping the mouth closed. If the patient is consistently crying, the device will only be able to deliver flow, not pressure. In general, I don't feed into the stomach on a RAM of more than about 4, as the stomach will also be seeing quite a bit of air, and the chance for emesis and aspiration is high. Along those same lines, you may need to consider placing a venting NG, or ventral lavine, to help decompress the stomach if the patient is getting distended and uncomfortable from the positive pressure. Finally, for bigger kids, we can use various types of masks to deliver either continuous or bi-level positive pressure. CPAP, or continuous positive airway pressure, delivers a constant level of inspiratory pressure to help keep airways open. It can be very helpful for oxygenation, but does not help much with ventilation or CO2 clearance. BiPAP, on the other hand, delivers both an inspiratory and an expiratory pressure to assist with ventilation as well as oxygenation. Both forms of positive pressure can be delivered through a variety of face masks, including models that cover only the nose and the mouth, or the full face. One thing to note is that nebulized treatments cannot be delivered via full face masks due to the risks of irritation to the eyes. We generally can't feed into the stomach on CPAP or BiPAP, but we do occasionally provide TP feeds to kids who are on positive pressure for more than just a few days. That concludes our introduction to non-invasive ventilation. Thanks for listening.